Hi, I'm Dr. Jasmine Thum, a neurosurgeon at the University of Alabama at Birmingham. In this video, I'm going to explain what a vagus nerve stimulator, or VNS, is, why we recommend it, what surgery looks like, and what to expect afterwards. A vagus nerve stimulator is a small implanted device that sends gentle electrical signals to a nerve in the neck, called the vagus nerve. This nerve connects the body and the brain. Stimulation helps regulate brain networks and can reduce seizure frequency and severity. Importantly, this is not brain surgery. We do not enter the skull. Instead, the device works through the nerve pathway in the neck. We consider VNS for patients with drug-resistant epilepsy, meaning seizures continue despite appropriate medication treatment. Based on large clinical trials, about half of patients experience a 50% reduction in seizures. This can be seizure severity or number of seizures. Improvement often builds gradually over months to years, so the initial programming session is not necessarily indicative of where you will be at in the long term. The procedure is done under general anesthesia, so you are fully asleep. We place the device on the left side of the body. There are usually two small incisions, one in a natural crease in the lower neck and one just below the collarbone where the battery is placed. A thin wire is wrapped around the vagus nerve, which sits between two major blood vessels that carry blood between the heart and the brain. After surgery, most patients stay overnight so we can monitor heart rate and breathing. If imaging looks good and pain is controlled, you usually go home the next day. All surgeries carry risk, although serious complications are uncommon with VNS. Infection occurs in roughly 2 to 5% of cases, and if an infection does occur, the device will need to be removed and replaced at a later time. Bleeding is uncommon, generally under 1 to 2%. In very rare cases, if there's too much manipulation of the vessels in the neck, a stroke can occur, but the likelihood of this happening is less than 1 in 1,000. Temporary voice changes or throat discomfort can occur early on, but usually resolve shortly after surgery. Give it about 2 to 3 weeks, and most of these symptoms will have improved. The device is not turned on immediately. About 2 to 4 weeks after surgery, your neurologist will program the stimulator and teach you how to use the magnet to either turn on the device or to mark when an event has occurred. The battery typically lasts 2 to 5 years, and replacement is usually a smaller outpatient procedure. This procedure usually takes only about 20 minutes, and you do not need to be under general anesthesia for a battery replacement. We typically go through the exact same incision that you had before, just below the clavicle, in order to access and replace the old battery. I typically use dissolvable sutures in both the neck incision and the chest incision, but we still like to see you back in clinic about 2 weeks after surgery just to make sure that everything is healing well. Vagus nerve stimulation is a well-studied therapy that can significantly reduce seizures for many people living with drug-resistant epilepsy. It is one of the many tools that I have in my toolbox as an epilepsy surgeon to help my patients who have epilepsy to hopefully improve their quality of life. Thank you very much for listening to this video. Please bring all the questions that you have to your clinic appointment, and I look forward to meeting you in person soon.